we now move on into our second half of the session today with Ken Cahill. Ken, are you with us?
Morning, good afternoon.
All good now. So Ken is the CEO and co-founder of SilverCloud Health, a company with offices in Boston, Dublin, London. Prior to founding SilverCloud Health, Ken held senior positions in several multinationals, including Dell, HP, and Gateway. Ken recently received the 2018 MedTech Boston 4 Under 40 Award, and he holds a BSc in Computing, a Diploma in New Business, and certificate in Company Direction from IOD. So welcome, Ken, and thanks for joining us today.
Not at all. Thank you for the opportunity.
Are you joining us from Ireland, the US, the UK?
Boston this morning.
Okay.
Yeah, Boston on our first day of snow as well. So so winter's coming. And with being 2020, I'm sure it's going to be one hell of a winter.
Well, so for what it's worth, here in Ireland, it's cloudy and it's going to rain as usual. So you're not missing much. At least you get to see the snow. It's been more interesting. So the idea here for the second session is to have really more a chat about your experience with around the SilverCloud and your experience so as an entrepreneur and as an expert in the digital health space. So can you tell us a bit more about what SilverCloud actually offers?
Yeah, certainly. SilverCloud is a digital mental health platform. So it's designed to enable organizations to provide earlier and easier access to mental health care. So coming and going across the full kind of acuity spectrum, from well-being, such as resilience, life skills, sleep, stress management issues, into then full interventional challenges with depression and anxiety. And then we also will cover comorbid challenges, such as diabetes, cardiovascular disease, COPD. And the purpose and point of that is that there's usually and typically a very high comorbidity between a chronic or long-term condition and mental health challenges. So one of the stats that I kind of often would repeat would be something as relatively normalized as diabetes. About 45% of people who have diabetes will have a clinical level of depression, anxiety, or stress. And those numbers would range right the way up to 70-75% plus when you go into certain forms of cancer, like head and neck cancer and other elements like that. So the approach on the chronic disease side is really trying to put the head and the body back together again, rather than dealing in such subspecialties all the time. So focusing on things like, anxiety around guilt and shame, maybe anxiety around sexual health, those kind of elements. So impacting the mental to impact the physical to then impact the mental is the approach there. We spun out from research in 2012. So we were part of the National Digital Research Centre in Dublin, which was involving Parents Plus, which is a charity under the auspices of Mater Hospital, as well as the Department of Computer Science and Statistics in Trinity College Dublin. And the purpose and point was to really, I suppose, bring together amazing technologists, academics, and clinicians to look at the challenge of digital delivery of mental health. And that, somebody used the term, which was kind of strange, which was like, mental health all of a sudden has become kind of a buzzword, or digital delivery that has become kind of very of the now. The approach that we, with the team, I should say, took, rather than me, the approach the team took was looking at the barriers that were limiting digital delivery. And if you think about it logically, was low patient or client or member, whatever your term might be. So low client engagement, high client dropout, and limited clinical improvement. So essentially, solutions weren't working. They weren't working when they were being deployed and delivered into real world populations. So we saw some interesting, let's put them that way, randomized controlled trials that were run, but they had very, very funky inclusion and exclusion criteria. And that's what happened then when they went into real world deployment and delivery. They failed massively. So the team worked on that well over a decade of research. We spun out in 2012 to form who we are. We kind of focused on going after the UK market first. which we still do. It's still a huge part of our business and organization and focus, as well as the US. So I moved over here to Boston 3 years ago this month with my wife and 2 kids. Up to that, I was probably flying 70-80% of the time back and forth to the US. So my wife had a bright idea. Well, rather than flying back and forth to the US 70-80% of the time, when we moved to the US, and you need to fly back 20. So she was right, as they usually are. So we kind of operate then across kind of a number of key areas. They would be health systems, healthcare plans, and indeed large employers as well. And happy to dive into the subtleties and nuances which I'm still grappling with in terms of US healthcare versus what we might be more familiar with in Ireland or even in the UK as well.
Yeah, so you mentioned mental health, which of course is a hot topic at the moment, given the conditions we are living in, from a journey from lockdowns, recurring lockdowns as with the one we're having here in Ireland, but generally speaking, even just the anxiety of getting the virus and those things. So how has COVID-19 impacted your business?
Significantly, I think, like everybody else, but we're thankfully one of the lucky ones. You know, when I look at particularly kind of some of the small businesses, the coffee shops, the pubs, the bars, the restaurants, through, you know, a whole host of other kind of what would be classified as non-essential services. Yeah, they're being really, really badly affected by it. And then on an individual basis, you know, there's hardly a group out there that isn't being affected. So if you have elderly relatives, parents, whatever, or maybe, you know, family members who might be more susceptible, or in terms of other conditions, then, you know, we've seen challenges with people who have kids, who have children. We've seen challenges with people who are single and on their own. It's kind of universally across the board. And then we've people who have a chronic condition and are getting delayed treatment and care. Now, thankfully, we've seen that backlog fall off a lot. But that was a huge issue for the first half of the year, or the first half of the first kind of couple of months of this, where the delay in chronic care was causing a huge, you know, exacerbating the mental health side of it, and showing how those two are so closely interlinked on it. You know, but from put on the kind of business hat for a moment, you know, we have 75 people in the SilverCloud. We have 40 in Dublin, around Ireland. We have 20 in the UK, a little over 20 in the UK, and a little over 20 in the US. So it's been interesting seeing the various waves and peaks hitting different countries and different levels. And even it's been interesting seeing that, talking to governments. So Irish government, UK government, we've been speaking to quite a lot, and a number of US federal and state officials as well. And seeing different levels of response and different tones to response as well, which has been quite interesting to hear. But as a business, I think we're challenged in a lot of ways. We're challenged because there's a huge demand for what we do and our services, and then we're also challenged insofar as, you know, we have a team who have, you know, the same as everyone else. Some will have kids, some will be on their own, as in single. Some will have elderly parents who they're concerned about. So yeah, you're kind of getting the impact on both sides.
So if I look at your website and then I had a look last night just to try to understand what's the platform like and so on. So to me, it sounds like it's a cloud-based platform, isn't it?
Mm-hmm. Correct,
and so I guess your scalability issue at the moment is more on the onboarding side of things, more than on the technological side. Is that right? Or am I off?
Yeah, I think it would be, broadly speaking. I mean, in February, March this year, we reached out to all of our customer organizations, either ones that we had contracted with or ones that we've been speaking to. And we spoke to them. We spoke to the HSE, we spoke to the HSE workforce, NHS workforce, and a whole host of other groups. And we basically said, listen, what can we help with? We were fortunate enough, we had closed our round of funding, our Series B, and we kind of felt like if ever there's a time for a digital mental health company to step up, we kind of wanted to do it, but we wanted to do it first, and not, you know, I think our approach was to kind of do it kind of subtly in the background. So we reached out to all those different organizations. We asked them, what can we help with? And they said, well, listen, depending on what part of the world you were in, some had different approaches to it, but most of them said, listen, can you help us with our frontline staff? Can you help us with that first, please? You know, the challenge, and this often happens, and even speaking with the HSE on this, you know, they were overwhelmed with the level of support that they got from tech companies, from everyone around the world to try and help out where they could. And they said the biggest challenge now is all these services coming in together and everyone tripping over each other. So again, it was the key area that those organizations felt we'd fit in was with their frontline staff, rather than coming in trying to rechange everything that was there. The change management would have been just too great. And then we had organizations who were saying, yeah, our frontline is what we need to work with. We're currently erecting tents at the front of our hospital here. We don't have enough gowns. We don't have enough ventilators. If you think back to kind of February or March time, when it was kind of the heightened panic mode. So as a result, then we opened up the platform, I think, to about 180 million people, free of charge, to provide access to those sleep, stress, resilience programs. And the team inside developed a COVID-19 program called Living in Challenging Times, which was tackling a lot of the issues, which was giving, you know, great salient advice in terms of limiting your news inflow and that kind of idea, and you know, using trusted sources of information. And they developed that in, I think, 18 days, and then tested it and then released it. Yeah, so that was kind of so as you can imagine, that was a huge workload on the team. Then the team themselves are all being affected by what was going on. So there's certainly hats off to the team in terms of what they did over the first kind of 4 or 5 months. It was pretty epic.
That's great. You mentioned funding. So funding is usually something that many startups worry about for obvious reasons. And then it's very...
we all do, yeah.
So it's very important to scale up quickly and to reach out markets when the timing is right. So what was your funding journey like?
So we've done 3 rounds of funding. We did a seed, an A, and then in February this year, that was our Series B funding round. We're really lucky. We've had all the investors who've been in with this have come in each one of those rounds. So we've been really fortunate in terms of having a very, very, very supportive investor base, which is not usual. I'll be honest, it's definitely not usual in any industry, but which has been phenomenal. And they're all active participants at a board level, and not even just at the board, but outside the board as well. So we're really fortunate with you know, some of the kind of investors such as Investec, ACT, Venture Capital have been phenomenal. And then in this round, we closed off. We were really kind of cautious is the wrong word. We wanted to try and put together a funding round that was the right shape and type for us. We are an Irish company. Our knowledge of US healthcare isn't as deep as we would like it to be. I've subsequently realized US knowledge of US healthcare isn't that deep either. I'm joking saying that flippantly, but what I mean by that is we want to build up that rapid knowledge of what was there, that market access, those market contacts that we wanted to do. So we were very fortunate to be able to build a strategic investment round, which was represented by organizations, some of them who are our customers 4 and even 5 years, such as OSF and Unity Point and Memorial Care, and then bringing in clout of kind of well-known investor groups like LRV here in Boston, who are kind of a healthcare fund, which has got a significant number of healthcare systems funding into them. And that on paper anyway, as a kind of vanity metric, all of those directly or indirectly would have access to it 40% of all patients within the US healthcare system. So really, really smart, really, really well connected organizations, but continued support from the likes of ACT Venture Capital has been hugely important as well. And you know, they're well able to hold conversation on a US healthcare context, to put it mildly. So yes, we built that, and that was kind of so we closed a shade under $90 million of funding in sort of February, March time this year.
Yeah, that's very good. So you mentioned your first market was the UK. That was the market you were going for, and then you jumped on the US side. So now I guess you have customers at least in 3 markets, if not more. And how does Ireland, based on your experience, how does Ireland compare to other markets when it comes to digital health adoption generally?
I think it has been challenging. I think, as an Irish person myself, I think we often look skeptical at software and paying for software. And we often feel that we could get our cousin or our nephew or somebody else to build what you offer them for a tenth the price. But we've seen huge strides in terms of that over the past number of years. For us, we needed to get rapid adoption. And in fairness to the NHS in the UK, they were way ahead in terms of delivery. They had progressed over this 15-year window, essentially, about delivering digitized cognitive behavioral therapy, this digitized mental health supports, and had done an amazing job at it, whilst other countries hadn't reached that point of kind of decision point and decision making. Now, huge credit to the HSE and to other organizations in Ireland that we've worked with a bit over the last 6 and even 12 months. They've moved massively forward on both the need and requirement of what's there. If we look back in terms of when we kind of began entering the UK market back in 2010, 2011, I was joined by a colleague of mine, Aisling, on the sales side. And, it was in some ways, if we think back to that period of time, it was almost a welcome relief to get on a flight from Dublin and land in London or Manchester or Liverpool or wherever it might be, because Ireland was kind of locked down in terms of economy. And you would arrive in London and it was all business, it was all progress, it was all kind of still go. So it was welcome, kind of doing that kind of flight essentially every week, number of times a week in some weeks. And we entered that market. The NHS is, as you know, it's a single payer market, but it's not a single buyer market. So there's 150 plus NHS services across the UK, across England, and there is a huge network effect. So you can bring one on, you can bring typically the neighbouring service if you do what they need insofar as quality of outcomes, access, and indeed cost reduction. You need to hit those 3 buttons. If you can do that, you partner well with them, you build a good, strong relationship and reputation with them, you will do well insofar as you'll be able to expand out. And the NHS has been very, very, very good to us. We today would have, so we entered the market back probably 7 years ago. Today, we'd have about 84% of the entire NHS's mental health services using our platform to deliver mental health care. So we're very, very proud of that. And have a phenomenal team in the UK who service that full time. And then we also work with a number of private healthcare organizations, major employers in the UK, like Tesco, like Jaguar Land Rover, Cadbury's, JP Morgan, and others, which we're really proud of to support as well. So that was kind of the UK, and we, one of the kind of key pivotal points for us was the UK partnering with one of the NHS services, Berkshire NHS, which is on the west side of London. Partnered with them as an incredible organization who was really trying to move things forward, really trying to push things forward. We partnered with them, which enabled us to co-build and co-develop a number of programs and widen our content library. So our content library would sit about 30 evidence-based programs today. But that took time to hit that milestone of being able to deliver across the full continuum of care. Prior to that, we partnered with that NHS service with Berkshire, and Judith Chapman, who's our clinical director there, partnered with them to co-build these programs and bring them across the NHS. And that was a key decision for us to make, and that was a key pivotal point. Never underestimate the power of a partnership if you can manage it well. At the same time, then we were trying to bring on the UK and the US, but the challenge was the US has been the graveyard of so many Irish companies and so many UK companies as well. It's a big market. It's very expensive in so many ways, in terms of care, in terms of resources, in terms of everything that's there. And it's just very vast and very large and very confusing and very overwhelming all at the same time.
There's probably also a big difference from a cultural perspective, how they approach the market and they approach sales.
Well, healthcare is completely different over here. And I'm not being derogatory when I kind of talk about some of the points here. It's just the way the system is. It was built this way, and it has been built this way over decades, essentially. You know, for me, your starting point is typically for, without sort of grabbing a headline here by saying something silly, but typically a doctor to become of that status, you're looking at $350,000 of education cost. And that's what they start with. That's when they start their career. So they exit university or college and they start their career with this huge level of debt. And that is kind of the starting tipping point of the challenges that are there in healthcare costs. You know, it's an adage I've quoted a number of times. If you're familiar with a medication, over-the-counter medication in Ireland or in the UK called Civirex, it's a cold sore medication. It costs about, I think, probably €5-6 for a 2 gram little jar of it. 2 jars of that here without insurance could be north of $600. With insurance would be north of $90. The cost of healthcare is just exponentially higher here. An ambulance will cost you $5.5 grand to bring you a mile down the road. It's very strange. The US healthcare system, if you are in urban areas, is one of the best healthcare systems in the world if you can afford it. And that means you have healthcare. And that then brings on 55% of Americans get their healthcare through their employer. Healthcare costs are one of the biggest reasons for people to declare bankruptcy in the US. It is a huge cost. Now, there's been some significant changes where they've eradicated things like, which just blew my mind when I moved over here first, was you could run out of healthcare coverage for cancer. So you could have, bowel cancer, and you could just max out your insurance. And then what happens? So, there isn't that kind of healthcare safety net as we would be used to in Ireland and the UK. So, but that provides an opportunity for what we kind of do, because there is such a heavy cost of care delivery. Digitizing and digital delivery is amazing because US is a huge expanse of space, huge number of people, 330 million people, but spread very wide when you look particularly in the middle. By providing digital, you can provide it at a significantly higher scale, better outcomes, lower costs. And where that makes the most sense is in the US. It's one of the biggest healthcare consumers of the world, and is extremely focused on the cost of healthcare delivery. So that provides a huge opportunity for digital health companies and health companies that are trying to advance and move forward with that kind of healthcare backdrop. Having 2 kids, 6-year-old who is amazing, but he's like a little old man, and then a 4-year-old, 2 boys, 4-year-old who's Daniel, who is, if we're able to keep him out of prison, will be amazing. He's that kind of child. So I think we've had 6 chest x-rays on him. We've had CAT scans on him. He's given himself a concussion 3 times. He swallowed a coin once. He's 4. He's just one of those kids. But it's amazing to go through. You don't appreciate how healthcare is done in Ireland or the UK until you've kind of lived here, until you've gone through the process and you get charged $90 because your kid had a juice box in an emergency room. And people are just going, what? You go, yeah, that's just part of it. You sit there and a doc might go, oh, what insurance have you got there? Oh, you have that. Okay, cool. We'll run that test because that's a billable. We'll run that test because that's a billable. And we'll run that test because it's a billable. It's just a very different mindset. I'm not saying it's wrong. I'm just saying it's very, very different. It's just a completely different approach. In terms of that being said, my kid got a CT scan, chest x-rays within about an hour. You walk in, boom, 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 straight done, and you're back out within 2 hours. Amazing in terms of that. So.
Yeah, so I guess it takes a bit of time just to get used to that, to get into that type of mind frame, really.
Absolutely, and it is ridiculously complicated. I consider myself a reasonably intelligent person, but the level of complexity in terms of insurance coverage, if we think looking at VHI and LEA and others in Ireland, comparing that to the levels of deductibles and co-pays and this and opt-ins and this and that, it is really something else to try and work out what you should actually owe at the end of any form of treatment, even a checkup, be it virtual or in person. It's interesting. Yeah.
All right. Just before I move on to the next question, just for our audience, if you have any questions for Ken, just please type them in into the Q&A feature that's at the bottom of the screen. I think we'll have time to go through some extra questions there. So Ken, you mentioned essentially it's a technology. Yours is a technology company in the healthcare space, and then I think mentioned it's a mix between psychology, psychiatric treatments, and additional treatments. So to me, it looks very diverse. As I say, your team must be very diverse. So how does it look like? I mean, what kind of people you have in your team? Where they come from?
Yeah, there's a diverse background, and kind of, we've been fortunate in terms of the approach that we have taken, that we have kind of, brought together academics, clinicians, technologists, and commercial people, and basically made all those different areas work together, because we had seen from other deployments in other areas that the challenge was they either had way too high a technology but weren't able to commercialize it, too commercial and nothing to back it up, all sizzle, or they had really amazing clinicians and not the tech to integrate it. The challenges is you need to sort of deliver against them all. And that was our background in terms of that academic and clinical research in under the NDRC, whereby it was a combination of those kind of 3 or 4 factors coming together and making sure that they all felt motivated. They all felt that they were part of what was going on ahead. So when you're bringing on a big organization, it was a dollar amount, of course, it was a revenue, but it was also, an ability to be able to deploy technology at scale. It was an ability to be able to bring on patients or end users or clients. And indeed, perhaps it was an ability for us to do joint research. So we've kind of kept that alive, that kind of research background. And when I say kind of kept it alive, we fully kept it alive because we feel it's such a huge differentiation. So we've delivered the platform since 2012 to over 500,000 people. I think 503,000 this morning was when I saw the last count. So that's 503,000 people who've actively gone in and signed up and begun one of our programs since 2012, with half of those, about 250,000 of those in the past 12 months alone. So the ramp rate is kind of like that, which is amazing. And we then integrate it within sort of technology solutions, so patient management systems, case management systems. So you can walk into a huge number of health systems and healthcare providers here in the US, and the doc, primary care physician, GP, is able to prescribe you access to one of our programs, which is an amazing, I suppose, feat or achievement, if you want to call that, of what the team have done insofar as simplifying and bringing and integrating digital into the care pathways. And that, to integrate something like that into care pathways, takes incredible product people, incredible tech, incredible security. It's a huge issue. Incredible security, research, clinical, and indeed commercial and customer success people. It kind of takes an army to do what we're doing within healthcare. And we're at this 8 years, and healthcare is one of the most challenging entrepreneurial areas of any that I'm aware of, anyway, in terms of bringing a company to scale. It's there's such a high level and high degree of inertia that's there.
Yeah, I mean, I was just about to say that you definitely didn't pick the easiest industry ever,
no.
Particularly for a technology company. So if you had to go back to the very first day of this, the SilverCloud idea, now I would say that's a success story, but then would you still do anything different?
I don't think I would. I think putting on kind of the entrepreneurial hat for a second, to do what we're doing now, what any of the kind of entrepreneurs have done or doing, and people who are on the webinar now have done or have tried, is kind of the definition of madness in a certain way. It's why would you go and put yourself out for such a high level of rejection? The odds are so stacked against you, and you have to constantly evolve and change every time. The stuff I know now, I probably didn't know 1% of it back 6, 7, 8 years ago. So it's been amazing. But it's a big challenge. You're constantly evolving. You could kind of make a joke at it and go, "Oh, I wouldn't have done this. I wouldn't have started." I completely disagree with that. This has been a phenomenal journey. The user feedback that we've gotten from the platform in terms of it's deployed and delivered, for me, coming to the US and the first number of visits, seeing the big logos and the big names on the buildings, and these are big names because they're big organizations, these big healthcare deployments. I'm so proud, and I love seeing those organization logos with us, and kind of living in Boston now, driving wherever throughout Boston, and I drive my wife wild by sort of saying, "Oh, customer of ours," and I love that. And it's whatever it is. It might be childish, it might be competitive streak. I don't know what it is, but it is that. Sometimes that can be just a hugely important part of what you do and keep you in the game. No, I think, would I do anything different? I'm sure loads of things you would do differently, but loads of things that you don't have the data points to understand what the different choice would have gotten you to. So a great expression has been given to me before, and perhaps it's the benefit of working in a mental health company, in terms of my level of resilience, has come up significantly. But listen, if you're happy where you are right now, everything up to this point has been good. The good, the bad, they've all been learning experiences. I've had huge failures from an entrepreneurial background in the past. And the American rephrasing is they were learnings. Never really felt that way for me, but I'm sure for others, I'm sure they were more mature about that approach. But yeah, I think for me, it's the resilience. It's remaining in the ring long enough. Keep taking the punches. Keep adapting. Keep sort of improving all the time. Persistence is really the biggest quality, I think. And don't be tone deaf. Will be another one as well. So you'll have to evolve. I have a stack of books there. I'm going on to another course in the next couple of days. I'm doing my chartered director exams in a couple of weeks' time with the Institute of Directors. You have to keep evolving. What got you to here, each one of those stages all the way along, will not get you where you want to go. It's a different skill getting from 0 to 1 million, 1 to 5, 5 to 10, 10 to 20, all the way up. They're that, and then having 0 to 5 people, your first employee, your first team member, and then scaling that up is very different set of skills that you have to kind of master, learn, quite honestly, all the way up.
The company really changed with you as well, because it's very different, as you said, just to manage 5 people at the beginning, 4 or 5 people, and then reaching out to 75 people across different countries requires a different set of skills. So absolutely. Now, if we flash forward to the next 5 years from now, okay, when COVID would be gone, hopefully, and so what would you think would be one of, say, the major changes in the digital health space from a market perspective generally?
I think there'll be a couple of big changes. I think we've seen a huge number of digital health companies appear over the past year or two. And we see that, you kind of see that every industry, if you go back and you look up brewing, you go back, even in Ireland, the kind of whiskey sort of revival, watching a video on it before, I think we went down to as low as kind of 5 distilleries in Ireland at one time back 40 years ago. And now the number that we have today, these ebbs and flows and changes and big mass consolidation, we will have a significant level of attrition of digital health companies, because I think the market has matured rapidly over the past 6 months. And the big questions they're asking are, it's outcomes. It's all about outcomes. And we kind of push that very heavily as part of our key message. If the organization is not looking for outcomes, they're looking to tick an innovation box. And that's a very different need and requirement versus an organization saying, hey, we're looking for this because we want to improve access, we want to improve quality, we want to improve reach, scale, and clinical outcomes. You will see as a result of that organizations making way more informed decisions and going by the ones who have the multiple randomized controlled trials and real world data. That would be one thing. So you're going to see a big consolidation and attrition rate in the next kind of two years, I would say. The organizations have vastly improved their knowledge level as well. They know what they're now asking for versus, when I started here 2-3 years ago in the US, in a kind of more concerted effort, you were educating them on what this was. This was niche. Now we're drawing out user paths that are full system. I mean, primary care, secondary care, their own employees, community delivery, specialist delivery, mental health across all 5 or 6 of those segments. You're talking 5-10 million people at a time. So that's a huge difference. I think there's going to be a struggle. There's going to be a battle between health systems, how the money flows, in terms of the health payer, be they commercial or public, and you're going to see a change in terms of the sort of the health system being the kind of core delivery of healthcare, and perhaps a movement towards more digital first, digital front doors, perhaps more of a movement towards more retailizing. So you're seeing kind of pharmacies trying to step up into that world a little bit more. The phrase is consumerization of healthcare. Whatever that actually ends up being defined, I would definitely see that as being a big part. And digital can help so much. We pride ourselves in saying to an organization, we can bring you from zero to full digital delivery of behavioral and mental health in 8 weeks. And they kind of go, oh, that's very different than the big systems we put in before, anything else like that. And that's the benefit of what the digital age that we live in, that you can deliver at that sort of scale. So yeah, consumerization, deeper and deeper education and knowledge, higher levels of requirement, more mainstreaming of deployment and less sort of niche delivery. And then I think attrition and consolidation of digital health will be a big part.
All right. So I feel like I could keep you here with us for another 2 hours with all the questions I've written down on this sheet here, but I won't steal any more of your time. I really appreciate. I know that you made space in your agenda just to join us today, and I really appreciate it.
No, happy to. Thank you for the opportunity. And if anyone wants to reach out, if anyone has any questions, please email me. Email address is ken.cahill@silvercloudhealth.com.
Yeah, thanks again, Ken. And for all our attendees, this is a wrap for the Transform Health event. Our next event will be focusing on startups and scale-up companies. So this was a very nice way of transitioning between 2 events, and will be on from November 16th to November 20th. So running at lunchtime as usual. So just keep an eye on our website, iidb.ie, for any updates, and the registration will open next week. So thanks again, Ken. Thanks to all our audience, and see you in a few weeks' time.